Imagine you're thinking your biggest health concerns are things like arthritis or keeping an eye on your blood pressure. Then, out of the blue, you're diagnosed with an infection you thought was strictly for the grandkids generation. Today, we're shining a light on this often silent epidemic. We'll hear directly from seniors who are navigating these new worries, and medical experts will explain why this is happening. More importantly, they'll share essential prevention strategies so we can all make sure our golden years are truly healthy years. Because let's be clear, sexual health doesn't have an age limit, and neither does the risk of STDs. The golden years. We picture them as a time for new adventures, new passions, maybe even new love. And it's true, we're living longer, healthier lives than ever before. But this fantastic vitality can bring along an unexpected guest, one we don't often talk about. Right now, for adults aged 65 and older, diagnoses of sexually transmitted diseases, STDs, are climbing fast. Just from 2020 to 2023, there was a nearly 24% jump in this age group. That's the biggest increase of any demographic, and HPV, a common virus, shot up by a staggering 32.2% among seniors. This isn't just a number. It's a quiet crisis affecting real people, and honestly, many are caught completely off guard. Imagine you are thinking your biggest health concerns are things like arthritis or keeping an eye on your blood pressure. Then, out of the blue, you're diagnosed with an infection you thought was strictly for the grandkids generation. We'll hear directly from seniors who are navigating these new worries, and medical experts will explain why this is happening. More importantly, they'll share essential prevention strategies so we can all make sure our golden years are truly healthy years. Because let's be clear, sexual health doesn't have an age limit, and neither does the risk of STDs. The golden years. We picture them as a time for new adventures, new passions, maybe even new love. And it's true, we're living longer, healthier lives than ever before. But this fantastic vitality can bring along an unexpected guest, one we don't often talk about. Right now, for adults aged 65 and older, diagnoses of sexually transmitted diseases, STDs, are climbing fast. Just from 2020 to 2023, there was a nearly 24% jump in this age group. That's the biggest increase of any demographic, and HPV, a common virus, shot up by a staggering 32.2% among seniors. This isn't just a number, it's a quiet crisis affecting real people, and honestly, many are caught completely off guard. What it means to age is changing, and it's pretty remarkable. People are working longer, staying active, and yes, enjoying intimacy well into their 70s, 80s, and even beyond. Things like Viagra and hormone therapies have certainly played a part in extending sexual vitality for many. In fact, about 40% of people aged 65 to 80 are sexually active, and nearly 2/3 of older adults say they're interested in sex. That's fantastic news, a real testament to medical progress and how society's view of aging is shifting for the better. But there's a flip side to this wonderful trend. As seniors embrace these longer, healthier, and more sexually active lives, many are also re-entering the dating scene, maybe after a divorce or losing a spouse. The catch? They might not have the same awareness of STD risks that younger folks have grown up with. That old idea that STDs are just a young person's problem? It's not just wrong, it's dangerous. The numbers really do paint a stark picture. Beyond that recent surge, STD rates among adults 65 and older have more than doubled in the US over the past decade. We've seen chlamydia cases in this group more than triple between 2010 and 2023. Gonorrhea cases, they've increased sixfold, and syphilis cases have soared nearly tenfold. This isn't some minor blip. It's a serious public health issue that's been simmering quietly for a while now. Unfortunately, many seniors, and sometimes even their doctors, just aren't prepared for this new reality. Behind these statistics are real people, often feeling completely blindsided by a diagnosis they never saw coming. Their stories highlight the surprise, the fear, and sometimes the shame that can come with STDs in later life. I'm Mary, I'm 72. After my husband passed away, I eventually started dating again. It was exciting, like being a teenager in some ways. But STDs? Honestly, they weren't even on my radar. Pregnancy wasn't a concern anymore, so I just didn't think about using protection. When my doctor told me I had an infection, I was floored, shocked, and a bit ashamed, if I'm honest. It was a real wake-up call. Mary's story isn't unusual. That assumption that condoms are only about preventing pregnancy is a common and risky one among older adults. My name is James, I'm 68. I started noticing some unusual symptoms, but I brushed them off. I figured, it's just part of getting older. Little aches and pains, things changing. The thought of it being an STD, well, that was embarrassing. It took me a while to even bring it up with my doctor. I wish I'd known sooner that it could be an infection, that it was treatable, and that I wasn't alone. The delay probably made things worse. These experiences really bring a critical issue to the surface. The silence and stigma around sexual health in older adults can stop people from getting diagnosed and treated in time. Many seniors worry their concerns won't be taken seriously, or they just feel too awkward to start these conversations. This hesitation can lead to serious health problems, since many STDs don't show symptoms right away, or have symptoms that are easily confused with other age-related conditions. So, why is this happening? Why are STDs, which we so often link with younger people, making such big inroads with seniors? We talked to medical experts to get a clearer picture of what's going on. Dr. Carter says several factors are coming together to cause this rise in STDs among older adults. First off, people are living longer, healthier lives, and with medications available to help with sexual function, sexual activity in this age group has gone up. That's a good thing, but it also means more chances for transmission if people aren't taking precautions. One of the biggest issues is low condom use. Since pregnancy isn't a worry anymore, many seniors just don't see why they'd need condoms. One study actually found that only about 3% of people age 60 or older had used condoms in the past year. That leaves them pretty vulnerable. Dr. Carter. There's also a real lack of awareness. Sex education campaigns have, for the most part, focused on younger people. So, many seniors simply haven't gotten the information they need about STD risks later in life. Doctors, too, might not always bring up sexual health with their older patients, either assuming it's not relevant or feeling a bit uncomfortable themselves. This is a huge missed opportunity for really important education and screening. The kinds of STDs we're seeing on the rise are varied. Chlamydia, gonorrhea, and syphilis are all increasing. HIV is also a worry. The number of people over 50 living with HIV nearly doubled in the US in the 15 years before recent reports. And then there's human papillomavirus, or HPV. Dr. Carter. HPV is a big concern because some strains can lead to cancers, like cervical, anal, and throat cancers. That 32.2% increase in HPV diagnoses among those 65 and older between 2020 and 2023 is a serious warning sign. Many older adults might not have been vaccinated against HPV because the vaccine was mainly given to younger people when it first came out. And while current guidelines often suggest stopping cervical cancer screening for women 65 or older if they've had normal tests, some research indicates this might leave this age group vulnerable, especially since HPV can be picked up later in life. On top of all that, natural body changes that come with aging can also play a part. For example, after menopause, vaginal thinning and dryness can make tissues more prone to tiny tears during sex, which bumps up the risk of infection. A weakening immune system can also make older adults more susceptible to infections in general. Dr. Carter. It's really important to understand that many STDs can be asymptomatic, meaning they don't show any symptoms, especially in the early stages. Or their symptoms, like tiredness, mild rashes, or unusual discharge, can look a lot like other common issues that come with getting older. This means infections can go unnoticed and untreated for longer, potentially leading to more severe long-term health problems and increasing the chances of passing them on to others. The rise in STDs among seniors is definitely a serious issue, but it's not one we can't tackle. Medical experts are clear. With awareness and some proactive steps, older adults can absolutely protect their sexual health. Dr. Bennington. The good news is that STDs are preventable and many are treatable, especially when they're caught early. The strategies are pretty much the same no matter your age, but they really need to be communicated effectively to seniors. So, what's the number one prevention tool? Using condoms consistently and correctly. Dr. Bennington, I really can't say this enough. Condoms are still so important. Even if pregnancy isn't a factor, condoms are the best barrier method against most STDs. This message needs to be loud and clear for sexually active seniors, especially those with new or multiple partners. Regular testing is another vital tool. That old saying, ignorance is bliss, it definitely doesn't apply here. Dr. Bennington, routine screening for STDs is essential, even if you think you're not at risk or don't have any symptoms. Many infections are silent. Doctors should be proactively offering these screenings to their older patients, and patients should feel comfortable asking for them. The CDC has a helpful approach for doctors taking a sexual history, sometimes called the 5 Ps. Asking about partners' practices, protection from STIs, past history of STIs, and pregnancy intention. That last one is less relevant for seniors, but the others are still key. Having open and honest conversations with new partners about sexual health histories before becoming intimate is also really important. It might feel a bit awkward, but it's a true sign of mutual respect and responsibility. Dr. Bennington, vaccination is another key way to prevent STDs. The hepatitis B vaccine is recommended for adults of any age who want it. And while HPV vaccination has mostly focused on younger people, the CDC's schedule does have guidelines for older individuals in certain situations, so it's definitely worth a discussion with a doctor. It's about preventing not just the immediate infection, but also long-term problems like cancer. Medical innovation is also giving us new tools. Pre-exposure prophylaxis, or PrEP, is highly effective in preventing HIV infection for those at risk. And a newer strategy called doxycycline post-exposure prophylaxis, or DoxyPEP, is looking promising. Dr. Bennington, DoxyPEP involves taking a dose of the antibiotic doxycycline within 72 hours after condomless sex. Research has shown it can significantly cut down the risk of getting bacterial STDs like chlamydia, syphilis, and gonorrhea, particularly in men who have sex with men and transgender women who've recently had a bacterial STI. The CDC has issued guidelines for its use, and it's an important option to discuss with your doctor if you fall into a higher risk category. But it's not a replacement for condoms and regular testing. Think of it as an extra tool in the prevention toolkit. Knowing what to do and having the medical tools are great, but they only work if we can get past the personal and societal roadblocks that stop open discussions and proactive care. The stigma around sex and STDs in older adults is a big one. Dr. Sharma, gerontologist, sexual health educator. There's this unfortunate tendency in society to sort of desexualize older adults, to assume they're not interested in intimacy or capable of it. This can make seniors feel embarrassed or ashamed to talk about their sexual health, and it can lead to doctors overlooking these really crucial conversations. We need to normalize the idea that sexual health is a part of overall health and well-being throughout life. Campaigns are starting to pop up to tackle this. Some use playful or direct messages to encourage seniors and their families to talk about safer sex. For instance, the STDs Are Timeless campaign by the AIDS Healthcare Foundation uses images of older couples to remind everyone that STDs can affect anyone, at any age. Dr. Sharma, education really needs to be tailored. This means giving clear, age-appropriate information that addresses the specific worries and misconceptions older adults might have. It also means training healthcare professionals to start these conversations respectfully and without judgment, making sure older patients feel heard and understood. Mary says, "Learning about my diagnosis was tough, but it also opened my eyes. I talk to my doctor openly now, and with new partners, the conversation about protection happens up front. It's not always easy, but my health is worth it. I want my golden years to be healthy, in every sense of the word." Mary's journey really shows a growing understanding. Taking control of your sexual health is empowering, no matter your age. It's about making sure that longer lives are also healthier and happier lives. How we view aging is changing, and it's bringing with it amazing opportunities for joy, connection, and fulfillment. But as we've seen, it also brings new challenges that need our attention and action. The quiet crisis of rising STDs in seniors is a wake-up call for more awareness, open conversation, and proactive prevention. It's pretty clear, we're living longer, and many are enjoying active sex lives well into their later years. This is a fantastic development, but it has to go hand in hand with the knowledge and tools to stay safe. STDs don't care how old you are. That assumption that you are too old for STDs, it's a myth, and a dangerous one at that. But there is hope, and there are solutions. Prevention is absolutely possible. So what can you do? First, talk to your doctor. Start a conversation about your sexual health, even if they don't bring it up first. Ask about recommended screenings and vaccinations based on your own situation. Don't let embarrassment stop you from getting essential care. Second, if you are sexually active, especially with new or multiple partners, get tested regularly. Catching things early is key to effective treatment and preventing STDs from spreading further. Many STDs are treatable, and some are curable. Third, always use condoms if you're sexually active and not in a long-term, mutually monogamous relationship where both partners have been tested. Condoms are still a cornerstone of STD prevention. And finally, share this information. Help break the silence and the stigma. Talk with friends, family members, and peers. The more we discuss this issue openly, the more empowered we all become to protect ourselves and the people we care about. Our golden years should be a time of vibrancy and well-being. By acknowledging the risks and taking proactive steps, we can make sure that new fears don't overshadow the joys of this chapter of life. Let's make these years not just golden, but also healthy. Thanks for watching Aged and Confused.